Good morning or afternoon, everyone. Thank you for joining us for the Learn the Signs Act Early webinar encore presentation from the IDIO conference. Please note that all participants are in listen-only mode, and you can use the chat box to enter your comments or questions throughout the webinar. We'll be monitoring the chat. We have a lot of content today, so we'll have limited time for questions, but we hope that you'll ask questions through the chat box or enter comments as you wish. This is Margaret Gillis from the DAISY Center, and this webinar is co-sponsored between DAISY and ECTA. And we're very grateful for our presenters today, and I'm going to pass it off now to Brenda Wilkins from OSEP, who will get us started.
Good, thank you, Margaret. Good afternoon. This is Brenda Wilkins. I am a state lead at OSEP, U.S. Department of Education. I would like to thank everyone for joining us for this encore presentation of the Learn the Signs Act Early Collaboration to Increase Development, Monitoring, and Early Identification webinar. So thank you. I would also like to introduce our presenters, our panelists today, which is one of them is me. Also Julia Abercrombie with the CDC. I would like to introduce Renee Jenkins with the Florida Bureau of Early Steps and Newborn Screening. Jennifer Kaufman with Rhode Island Part C, the Executive Office of Health and Human Services. And Rebecca Hughes from the Paul V. Sherlock Center on Disabilities at Rhode Island. So our agenda today, we will kind of talk about why OSEP focused on Childline, the overview of CDC initiatives, Florida's initiative, Rhode Island's initiative, and we will talk a little bit about resources. So with OSEP, why did OSEP focus on Childline? And Margaret, if you could move the slides, that would be great. So why did OSEP focus on Childline? Well, back in
Brenda, I think we may have a poll for the audience.
Oh, I'm sorry. Go ahead.
So please select your role, and you can select multiple roles if you have different primary roles.
Thank you, Margaret.
So Christine, are we looking pretty good on results so far?
Can you see the results?
Yes, so it looks like we've got about 37% of you are Part C staff, Part B and 619 staff, about 5%. We have 11% for people who are Act Early ambassadors. We have 3 people or 8% who are National TA Center staff, and then 16 people who, 42% who marked other. So if you want to share with us what your role is, we'd be happy to see that in the chat box if you feel like sharing. Thank you all.
Thank you, Margaret. So OSEP and why OSEP focused on Childline. Well, in 2016, Childline was selected as a focus area for the differentiated monitoring support system for Part C. We noticed a need at that time that states are still continue to be challenged with identifying and serving children that are potentially eligible for Part C. So what we did is, in conjunction or in collaboration with the ECTA and DAISY, we developed a Childline self-assessment. This self-assessment was a tool that was developed to assist states in meeting the regulations and for implementing best practices to Childline. It's a 4-part self-assessment, as you can see in the infographics. that's on your screen. It focuses on the regulatory pieces of child find, and we want to identify, assist states in identifying best practices to improve efficiency of a state child find system. The third section, we also have resources and policy letters that are specific to child find, and we also have other resources that are specific to best practices as well. We rolled out the Child Find Self-Assessment on May 9th in a national TA call. It's now available on OSEP's Grad 360 page, and it is also available on ETSA's website as well, and that link is also in the resource section at the end of this presentation. Thank you. So I would like to, go ahead.
Oh, go ahead.
So I would like to go ahead and turn it over to Julia Abercrombie from the CDC to talk about the initiatives that the CDC has developed.
Thanks, Brenda. I'm so pleased to
You're welcome.
Thank you. Pleased to share information about CDC's initiative, Learn the Signs, Act Early. I believe many of you are familiar with the program, and I'm just going to share a brief overview and some updates and how we can support your child find efforts. You can go to the next slide, Margaret. Thank you. So you can see our mission listed here on the slide, and it really is to help find all children in need of services and supports as early as possible. So we are a very natural partner in your child find efforts. If you want to go to the next slide. This shows that there are three main components to our program's approach. The first and the backbone of what we do is to develop and share high quality, parent-friendly materials that enable parents and other caregivers to monitor children's development in an ongoing way. And we have tools to do that from 2 months to 5 years of age. And the way we connect families to the materials is through programs that already serve families. So we work closely with WIC, with hospitals, pediatric practices, early learning, home visitation, and other programs that are already serving children from birth to 5 years. And to help integrate these resources, we fund Act Early initiatives like the Act Early Ambassadors, which you will hear from 2 of them later on in the webinar today. And they work to improve early identification in their states and communities. And then thirdly, we fund research and evaluation programs to continuously improve and tailor what we do. So next slide.
And Julia, we're getting some comments that your speaker is really low. If there's a way to move a little closer to your mic, that would be helpful.
I will try to do that. I'll try to get as close as I possibly can.
That sounds better on my end.
Sounds good. Okay, next slide. So some of our materials and resources are pictured here. They all encourage parents and caregivers to track and celebrate their children's milestones, as well as provide clear and concrete guidance about what to do if there is ever a developmental concern. The newest of our materials is the Milestone Tracker app, which is in the middle of the slide. And I'll tell you a bit about that in a second. But if you want to go back to the previous slide, I want to show you a highlight for you that we also have children's books. We have one for 2 years, 2-year-olds, one for 3-year-olds, and we just put up our book for 1-year-olds, Baby's Busy Day, Being One is So Much Fun. We put the PDF of that book up on our website, so you can access it now. And we expect to have printed copies of that board book later in the fall. Another resource I want you to be aware of, if you're not already, is the Watch Me training. Watch Me Celebrating Milestones and Sharing Concerns. This is a 1-hour online training for early educators that's worth continuing education credits. So this is a great resource to share with your referral sources in the community in early education. And then we also provide tip sheets for parents who have concerns about development and tip sheets for professionals with tips on how to talk with families about development. The materials are all in the public domain. There's no copyrights. We will give you files that you can customize yourself with your own agency logos and information. You're going to see some examples of how our ambassadors have done that. And they're available in different languages. Most everything's available in English and Spanish, and then many are available in Korean, Vietnamese, Haitian Creole, and other languages. So reach out to us if there's a particular translation that you need. Next slide. And the app, of course, is an excellent paperless option. It's interactive. I hope that each of you will download the app and explore the features that are available for families. It's on the App Store and Google Play. It's free, just like all of our resources. And it features milestone checklists with photos and videos of each milestone and reminders about developmental screening, parent tips, and then, of course, guidance on what to do if a parent notices the child's missing a milestone. So please check it out. Next slide. A word about the milestones themselves, so you're familiar. The milestones in our materials come from the American Academy of Pediatrics. They are available at the different ages that AAP recommends well-child visits. And so that we have a complete set, we are working with AAP right now to develop a 15 and 30-month checklist. So we'll have a checklist for each well visit age. So we hope to be able to provide those soon. And I want to note also that these are milestones that most children should reach by these given ages. So they're not an average. So if a child is missing one of the milestones on these checklists, it's a good idea to have a conversation and could be a prompt for developmental screening. Next slide. And I want to be super clear that the milestone checklists that we provide are not screening tools and not a replacement for screening, but rather a complementary tool that supports developmental monitoring, which goes hand in hand with developmental screening, but of course is not a substitute for screening. So both are recommended for early identification. So our tools support that ongoing parent-engaged developmental monitoring. Next slide. We, over the past several years, have surveyed and followed up with early intervention agencies that have been ordering our materials in bulk. And this slide shows some of the ways that they're being used. So agencies we know have customized the resources, they've shared with their referral sources, used our messages and links to enhance their child find campaigns, and distributed at different events. Here's a snippet of Nevada's Child Find website where they link to our site as a supplemental resource. Next slide. And the ambassadors. So currently our program supports 54 Act Early ambassadors who are professionals with a diverse background in either medicine or child development, developmental disabilities, early intervention. So it's a diverse group, but they're all champions for early identification, and they all serve as a program representative for our program and helping connect programs to resources that we provide. They are a great group of experts that can help you, if, for example, with your Child Find self-assessment, if that's something that you choose to take advantage of from OSAP. Next slide. This slide shows information on how ambassadors support Child Find, and this is from the 2018 ambassador reporting. So we asked for an annual report of activities from our ambassadors. And so 50 ambassadors contributed to this report, and you can see the % that have been sharing with their Part C programs or preschool special ed programs. And to the best of their knowledge, the % that report that they know that at least some programs in their state are taking advantage of the resources. So a couple examples from the report. I know that in the U.S. Virgin Islands, they're jointly creating a policy and protocols for incorporating our materials into their child find and surveillance efforts. And I know in Virginia right now, our ambassador is working with her Part C colleagues to incorporate our resources into their newly designed child find materials. Next slide. Another idea here is to work with ambassadors and connecting them to the parent centers. So last year we polled the Actorly ambassadors and asked how they were working with the OSEP-funded parent centers. And about 20% of them were connected to the parent centers at that time. And here's just a high-level summary of how they're working together. So if you are yourself affiliated with the parent center or you partner with the parent center, make sure that they're aware of the ambassadors as well and the resources that are available to them. Next slide. Here are the websites where you can go to get information or print the materials directly off the web, order them in limited quantities, or take advantage of the app. And lastly, I wanted to be sure that everyone was familiar with the Birth to 5 Watch Me Thrive initiative. This was launched maybe almost 5 years ago now. I can't believe it was that long ago. But recently, Help Me Grow updated the user guides that are a part of this initiative. And you can find these now on the Help Me Grow National Center website under Partners, and the link is provided for you here. So the Birth to 5 Watch Me Thrive was a federal interagency initiative to promote developmental and behavioral screening. And then it made so much sense for Help Me Grow to come and to update these, because for those who aren't familiar, Help Me Grow is the system model that works to promote collaboration in order to make systems more effective and help children reach their full potential. So it's a lovely partnership, and I just want to direct you to those resources. And it provides a nice segue, because you're going to be hearing next from Alexandra at Help Me Grow in Florida, who is also our ambassador. But I want to pause. Should I pause for questions? I saw some come up, or are we doing that at the end?
So I think we have a question about how the ambassadors were chosen.
Sure, I can answer that really quickly. Every 2 to 3 years, we have an open and competitive process where interested individuals apply to be an ambassador. And there's a review process, and it's usually pretty competitive. We don't have enough spots for everyone who applies, but that's generally the process. And the Association of University Centers on Disabilities is the organization that helps us administer the ambassador program.
It looks like that's all our questions at this time.
Great, thanks.
Thank you, Julia. I would like to go ahead and turn it over to Renee Jenkins and Alexandra Goldberg, both from the beautiful state of Florida. Renee? Or I think Renee is going first.
Yes, thank you. As Brenda said, I'm the Part C coordinator in the state of Florida, and I'm going to start off with the presentation, and then Alexandra will talk a little more about the work that's going on in Florida. If you turn to the next slide. Just a general overview of Florida's state structure for the Part C program known as Early Steps in Florida. Our lead agency in Florida is the Department of Health, and we contract with 15 local entities to implement the Part C program on the local level. And there are a variety of types of agencies, anywhere from hospitals, universities, to smaller nonprofit agencies. Next slide. Regarding our eligibility for Part C in Florida, in addition to children who have developmental delay or those who have conditions with high probability of resulting in delay, Florida added a little over a year ago children with at-risk conditions to our eligibility criteria. And these are medical risk conditions, not the social or environmental risk conditions. So children who are eligible under the at-risk category receive an abbreviated individualized family support plan. They receive service coordination and developmental monitoring in partnership with other community agencies or their medical home. And they also receive family support. We have in each of our local programs a family resource specialist who is a person who is a parent who is available to provide and assist families with whatever they need related to their child's development. And so whenever it's determined, though, through the developmental monitoring of the at-risk children that the child meets the eligibility under developmental delay, then that child is eligible to receive other developmental services. So leading up to and since this eligibility change that happened a little over a year ago, to add the at-risk, we worked to make the public and our primary referral sources aware of the change, outlining what's the same and what's different about what's available to children under these different eligibility categories. So next slide. So in addition to informing our communities about the recent change in eligibility, we've also identified a need to do targeted outreach to certain subpopulations, such as those who are homeless or in foster care or otherwise involved in child welfare. And as Florida is a large and very diverse state, it can be quite a challenge to reach these populations. And we find sometimes that what works in one area of the state may not work in another, or what might work in some of our larger areas like Miami, Orlando areas won't work in the more rural areas, maybe in the northern part of the state. So next slide. Recently, we did some updates to our public awareness materials, our brochures and information, which include information on children who are potentially eligible and how to make referrals and time frames for making referrals. We disseminate those materials at events statewide as well as on the local level. And we recognize that we need to continually review those materials to be sure they're appropriate for reaching the right people. And we've also made our local programs aware of the Learn the Signs Act early materials. Many of them are using them, have requested supplies of them, downloaded them, and have reported that many of the families that they work with really like the Milestone Tracker app. Next slide. So recently, what we've done in Florida is increased our efforts around stakeholder involvement. And one of our stakeholder groups has a focus on child find, and it's looking at whether we get the right referrals and whether children are identified early, or how we can do a better job, essentially, at child find. So Florida Alexander, who you'll hear from in a minute, Florida's Act Early Ambassador, is a member, along with some other partners who serve same children or who may come in contact with children before the Part C system. They're members of our stakeholder group, and they just help us to collaborate and stay abreast of any of the issues that need to be addressed related to finding children. The group did complete the self-assessment that Brenda talked about earlier, and that self-assessment was really useful in helping us identify the strengths of our child find system and where we need to focus our improvement efforts. Next slide. To work on our goals of early identification and getting the appropriate referrals, the work group, we made sure that the group included state level as well as local level partners. And the group has begun to look at data, and they're monitoring our referral patterns and trends. They're looking to see what the data tell us about where referrals are coming from, which kids we may be missing, the average age of referral to Part C. And we want to look more closely at the data and maybe disaggregate and drill down to see what issues that we need to address. For example, right now we're looking at the percentage of children referred to Part C who are not eligible or don't make it to eligibility determination. And there are concerns that we lose contact with a higher percentage of families than we would like before they get to their eligibility determination. And we want to know more about who those kids are that we lose contact with, and get some strategies around how we make sure those children are not lost and get to services. And we believe the stakeholder group will help us with that. Next slide. So we recognize that some of the children referred to Part C won't be eligible. So that means that in addition to making sure the public and partners know how to refer to early steps, the Part C system, we need to make sure that our Part C folks know how to connect families who may not meet eligibility, or even if they do meet eligibility, they may have needs for other supports in the community. So we have our Early Steps Central Directory, which is a requirement in the IDEA. The directory is on our website, and it provides information about the types of resources you see here on the slide. And we do review the Central Directory and add resources as necessary, so that not only our Part C staff can use the directory and refer families, but families themselves may also be able to provide information. So that completes my overview of Part C child find efforts around early identification and developmental monitoring. So I'll now turn it over to Alexandra, who will talk more about Help Me Grow and how we partner.
Hi, thank you, Renee. Hi, everyone. This is Alexandra Goldberg. I am with Help Me Grow Florida at the state office in Tallahassee, Florida at the Children's Forum. So I'm not really sure how many of you guys are familiar with the Help Me Grow system, and so I just wanted to give a brief overview of the system nationally and then specifically in Florida. So the slide we have up on the screen is a quote from the Help Me Grow national website. So Help Me Grow really is a system model. You know, sometimes you'll hear it referred to as a program, but we like to refer to it as a system simply because Help Me Grow can never exist by itself. We really depend on existing resources, existing opportunities, existing agencies to all work together so that we can work towards healthy development for children. Next slide, please. So Help Me Grow system works off of 4 core components. We have the centralized telephone access point, we have child health provider outreach, family and community outreach, and then data collection and analysis. Next slide, please. So up on the screen, you will see a map of our Help Me Grow Florida affiliates. So for the current fiscal year for 18-19, we were actually appropriated $2.2 million, and I apologize, that's a typo. For those of you that are familiar with state funding, you will know $200,000 makes a very big difference in our budget. So I want to clarify $2.2 million, and we're contracted with we have 13 affiliate sites in the state of Florida. So 11 of those are funded by the state coordinating office, and then 2 of them have other means of funding. So unfortunately, right now, we are not serving the entire state of Florida, and that is strictly due to budget limitations. We are currently serving 32 counties out of 67. So we're getting there. Next slide, please. So whenever I pull up this screen in presentations and trainings, I always get like a glazed look from everybody in the audience. But really what this is it's a representation of Florida's system of care for developmental concerns. And when I say system of care, really all I mean is just organizing all of the resources in the community so that people can just live better lives. So when you're looking at the screen, Help Me Grow is the lavender box, and the white boxes are the pieces that are needed to address children's developmental concerns and promote optimal child development. Now with Help Me Grow serving as this lavender box, we work on coordinating and connecting systems so that all families have access to resources to help their children thrive. We focus on making developmental screenings accessible for children and then linking the families to assessments and intervention services that are available in the community. Next slide, please. So in Florida, Florida is helping children and families kind of get on that healthy trajectory in many ways, and here it's broken down into 4 different sectors. So ECE programs, early care, ECE programs, early intervention, Part B and Part C, family support through home visiting, child care resource programs, and then health services, pediatric services, or mental health services. Help Me Grow can connect families to these services and support based on what the family is needing. But the really cool thing about Help Me Grow is that these services can also refer families back to Help Me Grow. So the referral can work both ways. Next slide, please. So in terms of Learn the Signs Act Early, as Julia and Renee mentioned, I am the Act Early ambassador to the state of Florida. And as a Help Me Grow employee, I've worked to kind of customize a lot of the Learn the Signs Act Early materials to customize it more for Help Me Grow. So some of the materials that we have customized, you will see we have our growth chart. That is a CDC Learn the Signs Act Early growth chart that we made to a sea animal theme, just to make it more fun and more friendly for kids. In the middle, you will see the developmental milestone checklist. We have customized this. You'll see the Help Me Grow Florida logo on it. We use these checklists in a variety of different settings. For example, in WIC offices, families, while they're waiting in the waiting room, can fill out the developmental milestone checklist, and then Help Me Grow can follow up with those families to do a developmental screening. And then on the far right, you will see we have the developmental milestones from Learn the Signs Act Early, and we actually have this on the back of our Help Me Grow Florida flyer. Next slide, please. So as part of being a program and training manager for Help Me Grow Florida, I do oversee our social media accounts. So we do have a strong social media presence here in Florida. We're on Facebook, Instagram, and Twitter. And I'm sure most of you know that it's a really great way to promote your services at little to no cost. So we found that very helpful. So the two outside images are from a campaign that Learn the Signs Act Early did with Talking is Teaching. They had a double-sided flyer with the images. So I took that and I did some cutting and pasting. I added our logo and I was able to create these images to post on social media. The image in the middle was created from a Learn the Signs Act Early fact sheet that explains the differences between developmental monitoring and developmental screening. The fact sheet was a little bit too wordy to post on social media, so I condensed it a bit. I added some of our Help Me Grow Florida information and I made it social media ready. Next slide, please. So we have some more images here on the screen. The Milestones Matter image on the right was created from a Learn the Signs Act Early flyer, and the graphic on the left was created from actually multiple Learn the Signs Act Early materials promoting their Milestone Tracker app. All of these resources can be found on the CDC's website. Help Me Grow also uses social media to promote some of our partners and agencies that we collaborate with, such as Early Steps, the Florida Department of Health, Early Learning Coalitions. So we find social media to be a really good way to connect with the people in our state. Next slide. So one of Help Me Grow Florida's most successful initiatives is our Books, Balls, and Blocks events. The events were formally funded by the Act Early State Systems Grant through AMCHIP and the CDC to promote the Learn the Signs Act Early campaign. Next slide, please. So what is a Books, Balls, and Blocks event? So these are our community screening events for children birth to 5 or birth to 8, depending on the people that you're wanting to come. So we have different activity stations set up throughout the venue while parents can fill out the screening. So children are playing at different activity stations. There are volunteers there that are modeling appropriate play, and the parents can fill out typically an ASQ or an ASQ SE on an iPad or on paper while their children are playing at the different stations. Now, the purpose of these Books, Balls, and Blocks event is to promote the detection of developmental delays. So by children participating at the different activity stations, their parents are filling out that screening, and that provides them an opportunity to better understand their child's development. So of course, parent education is one of the goals as well. By parents engaging in the activities, they get to actually experience what appropriate developmental play should look like. Parents are strongly encouraged to interact with the activities, and hopefully they can get some ideas for how to play with their children at home. And then community engagement. We love supporting other agencies in our community, and we often seek volunteers to help us out with these events. So volunteers from the community and other sponsoring agencies really are crucial to the success of our Books, Balls, and Blocks events. So we also have different agencies and vendors that can set up booths or can come support us at the event so that they can promote their programs as well. Next slide, please. So our Help Me Grow affiliates throughout this, there we go. Help Me Grow affiliates may co-host an event with a different community agency or partner, or they can have those agencies there in attendance, like I said, for family support. So in Florida, some of the partners, and this is not all of them, but some of the partners that we've been able to work with include some of the Healthy Start Coalitions, Head Start, Early Steps, the Early Learning Coalitions in Florida, Easter Seals, and the Florida Department of Children and Families. Next slide. So when looking at the future of the partnership between Early Steps and Help Me Grow, we've kind of narrowed down some things that we would like, that Renee and I would like to see in the future. So Help Me Grow will continue referring eligible children and families to Part C services, which here in Florida is Early Steps. Help Me Grow will continue to participate in the Early Steps Stakeholders Work Group. Like Renee mentioned, I am a member of the Early Steps Stakeholders Work Group, and it really is just a great way to kind of brainstorm and reflect on early step services. Early Steps will continue referring eligible children and families to Help Me Grow. Local Early Step sites will continue supporting Help Me Grow's Books, Balls, and Blocks events. And Early Steps will disseminate Learn the Signs Act early materials to their families. And I think that's it. Thank you.
Wonderful. And we have one question. Renee, I think this was from when you were talking about Child Find. The question is, how does Florida use a data tracking system, custom database or access database?
We have a custom database here in Florida that keeps all of our child information. It's an outdated database, and we're about to start on developing a brand new data system within the next couple of months. So we're looking forward to that, but it will be a custom base as well, not access. It will be just an improvement upon what we currently have in place.
Excellent. Thank you so much. So now we'll hear from Jennifer Kaufman and Rebecca Collins-Hughes from Rhode Island.
Hi, everyone. This is Jen Kaufman. I am the Part C coordinator in Rhode Island, and I am here with Rebecca Hughes, who is currently the Learn the Signs Act Early Ambassador for Rhode Island. We're very pleased to share with you some of the collaborative work that's been happening in our little state. Next slide. Next slide. Oh, there you go. So yes, Rhode Island is a state. No, it's not Long Island and not part of New York. We always like to clarify that. We are small, but we are mighty. Next slide. A little bit of information about our early intervention system in Rhode Island. We have 9 certified early intervention providers throughout the state that provide all aspects of our early intervention service delivery, from referral to transition to Part B 619 services. Our eligibility includes children with single established conditions and developmental delay. Our developmental delay definition is 2 standard deviation in 1 area of development or 1.5 in 2 areas of development. We also support eligibility for children who have documented risk factors and or concerns that have a significant impact on that child and family's functioning in their daily routine activities and natural environment. EI services in Rhode Island are of no cost to families. Medicaid fully pays for early intervention services for Medicaid eligible children. We also have some legislation that mandates in-state commercial plans to pay for early intervention services at the Medicaid rates. And for those children who have self-funded or out-of-state plans, the early intervention services that are not covered by those plans, Medicaid actually covers. So we're a very well-funded state in that manner. Next slide. So in Rhode Island, early intervention and Learn the Signs Act Early work very collaboratively to engage our stakeholders, and we're trying to promote a common message of early developmental monitoring and screening. We believe that training professionals to coach families on how to use the Learn the Signs Act Early materials will encourage earlier referrals and access to early intervention and other supportive services. We want families to have that confidence to track their own child's development, identify as early as possible that their child might be experiencing a developmental delay, and then, feel really confident and know who to call or where to go to access services for their child. And so in the following slides, Rebecca and I are going to share with you some of the specific activities and projects that we have been working on in Rhode Island. Next slide.
So one of the projects that we worked together on was creating this Rhode Island Early Intervention Deputy Ambassador Program. So in all of the early intervention programs, there are 9 of them in the state. 1 to 2 deputy ambassadors were identified for their programs. And that person, they are responsible for being the lead advocate and mentor for using the materials, the monitoring materials within the early intervention program. And they also help to order the materials, and act as a liaison between their programs and myself as the state Learn the Signs Act Early ambassador. Next slide, please. So we had our first training in September 2018, and we had all 9 early intervention programs represented, and 13 deputy ambassadors were trained. Next slide, please. So, and the way we communicate throughout this past year, we've communicated via a private Facebook group and also an email listserv. So we use these 2 ways to communicate with each other, where deputy ambassadors would talk about what was working well with their programs and what and seeking ideas from the other deputy ambassadors about challenges that they were having. So all early intervention programs now have a designated area with all of the Learn the Signs Act early materials, and all of the intake packets for all early intervention programs have Learn the Signs Act early materials in them. Many of the programs also use the children's books at birthdays, so the 2-year, at the 2-year and the 3-year birthdays, they kind of use those Learn the Signs Act early books during those birthday times. Also included in this, I've gone to several of the EI programs along with the deputy ambassadors and have done a full training for their staff as well. And then also for twice a year, we have an introduction to early intervention training for all new early intervention staff, and I've conducted a Learn the Signs Act early training for all new staff in those intro to EI trainings twice a year. Next slide, please.
So we are very, very interested in seeing if all of these efforts are having an impact on our early intervention system and having an impact on our families. So this summer, early intervention, we're working with Rebecca to collect data from our early intervention families to find out if families are indeed informed of the Learn the Signs Act early materials, and in addition, if they're actually using them and if they're useful. So after the analysis that will occur in early fall, the results of the survey, we're going to use that to inform our next steps and any further training that might be needed to continue this work. Next slide. So during the past year, Learn the Signs Act Early, Rebecca and myself have joined forces with the Autism Project, and we otherwise know them as TAP in Rhode Island. TAP received some funding through a HRSA grant to increase care integration for children with or at risk for ASD and developmental delays. In addition, TAP's efforts hope to increase earlier screening, evaluation, diagnosis, and enrollment in services. So these efforts included, obviously, the early intervention population, and since the vision and goals matched the collaboration between early intervention and Learn the Signs Act Early, we decided to join forces. One collaboration that we're involved in is that TAP's Creating the Connections training was actually made available to our early intervention providers as part of a larger ASD training. So before Rebecca talks about the collaboration on an outreach project with TAP, I want to mention that as of April 2019, 1,800 parents and professionals were trained through TAP, and over 13,000 milestone booklets have been delivered to parents and community agencies in our state. Next slide.
So one of the big projects we've been working on together along with TAP is outreach to the pediatric community. And so as of April 2019, we sent out 195 mailings to statewide pediatricians. And in these mailings, we sent samples of the Learn the Signs Act early materials, along with information about early intervention, as well as the training opportunities that TAP is able to provide. Next slide, please. So and included in the mailings was this flyer. So this flyer is geared toward pediatricians, talking about the 3 main points that we wanted to get across. ACT, ACT. So A is for advocating the use of the milestone trackers. C is to contact early intervention when delays are detected, and T is to talk to the Autism Project about trainings that they provide. And we also wanted to highlight that it's recommended by the American Academy of Pediatrics for developmental monitoring and developmental screening. So this is the flyer that was sent out to all the pediatricians. And as of yesterday, we've had 18 responses from the pediatric community requesting follow-up information about and asking for more materials for Learn the Signs Act Early so that they can provide to families in their practice. Next slide, please. And this is a poster that we created for the Pediatric Outreach Project. So this is in the process of being printed, and we will deliver these to the pediatric practices who requested more information. So this has the information about tracking milestones. It's geared for families. So while they're sitting in the waiting room at the pediatric office, they have this information will introduce them to Learn the Signs Act Early. And it also has each age group has simple developmental activities that a parent can do with their child in the waiting room that does not require any extra toys or materials. It's just a developmental tip that they could do while they're sitting in the waiting room. So this will be delivered to the pediatric offices as well. Next slide, please. And then another big project is our outreach to the birthing hospitals in Rhode Island. The biggest hospital is Women and Infants, but we are also planning on including all 5 birthing hospitals. And Women and Infants has 600 to 800 births per month, and our goal is to provide every baby and family leaving the hospital with a developmental monitoring kit. On the slide here, it says Milestone Moments booklet, but we felt that if we were to provide the Baby's Busy Day book along with the Milestone Tracker app flyer, it would have a greater impact just because the family would be able to use that baby book right leaving the hospital, and then advocating the use of the Tracker app. In addition to that, the next slide. This is the Caregiver's Guide to Developmental Monitoring. So this would be a part of that developmental monitoring kit that would be provided to all families leaving the hospital. So this is that informational flyer that is explaining the use of Learn the Signs Act Early Milestone Tracker. It's contact early intervention if and when delays are detected, and on the back of this flyer has all of the early intervention contact information, and then also to advocate talking to the pediatrician so that together the family and the pediatrician can recognize healthy developmental milestones and act early when delays are detected. So this is a big project that we are currently working on. We are currently seeking and securing funding to conduct this project, and the Department of Health here in Rhode Island has also backed us with this project as well. So this is just in the beginning stages, but we have a lot of energy and good support around this project in the state. Next slide. So other partnerships are, like I mentioned, we not just the biggest hospital. We're going to do all 5 birthing hospitals here in the state. I've been also working with the maternal, infant, and early childhood home visiting programs here in the state. They are already using the Learn the Signs Act Early materials during their home visits, so we're continuing that with sustainability. I've been working with Department of Children and Youth and Families, Child Welfare. We've created a developmental monitoring station in their main office in Providence, where the poster is going to be hung right in the waiting room there, as well as having the free materials for families to access as well. And then the big, we also, in Rhode Island, we have a free publication called the Family Guide, which is, it has community resources and events and information geared for families. And this year they're going to have 50,000 copies made. They usually have 30,000, but they've got a grant that this year there's going to be 50,000 copies made. And in that publication, there is going to be an article about developmental monitoring, as well as how to use the Learn the Signs Act Early Milestone Tracker app, and also to contact early intervention when delays are detected. So we have a lot of great, exciting things going on here in Rhode Island and great collaboration.
I think that's it, Brad.
Thank you. Margaret, do we have any questions in the chat?
I don't see any in the chat. Annie Converse, it looks like your hand is raised, so I was wondering if you had a question. If so, you can enter that in the chat. Or if anybody else has questions, we have a couple minutes, a few minutes for additional questions or comments. I'm not seeing any other questions coming in yet. Oh, okay. Annie said that she raised her hand by accident. She's very excited. I love that. That's great. It's wonderful to hear about all this great work that's happening.
And I think Evelyn made a comment from ESTA saying that Florida and Rhode Island have done even more work and great things in the past 6 to 7 months. So kudos to Florida and Rhode Island for your homework.
If anyone has other questions, you can go ahead and enter them in the chat, but I'm not seeing any come through yet.
Maybe while people are thinking, I just wanted to ask a question, and maybe it's just asking for ambassadors and friends for their advice. But if there's anyone on the webinar who wants to get started in making these partnerships between ambassadors and Part C programs and Help Me Grow, what advice do you have for them on how to get started?
So any comments for Julia about what advice you might have, ambassadors, for people who are interested in getting started with this?
Well, I think for me, it's really just getting out there and knocking on doors and building relationships. I mean, just with all of our work, it's really building relationships and helping state systems to understand the value of partnership and how the developmental monitoring can help their programs throughout the state. But it really comes down to building that trust and building relationships.
Wonderful. And yes, we had a question about the PowerPoint. This presentation is being recorded and will be posted on the DAISY website, and I assume also on the ECTA website. So you can access that there, and the PowerPoint will be posted as well. We had a question also about how you approach the birthing hospitals. Who on staff at a given hospital would you contact?
Well, I happen to be in a ideal position because I also do per diem work as an occupational therapist in the birthing hospital. So I had the contact already of who the medical director was for the mother-baby unit. So I contacted him and I was armed with the sample of all the materials, explained what they were and how they could be so beneficial to new families and babies leaving the hospital. And he right away, he was right on board, and he saw the value right away. So I actually was in a lucky position to be able to actually work in the hospital.
That's wonderful. And we have a comment that's from Lorraine that says, start small and find one person who will be an advocate within the system you are seeking to pursue for Learn the Signs Act early integration. So that's a great comment. It doesn't have to be taking over the world immediately, but starting small. Any other questions or comments? Okay, I think then we are ready to move on to we're going to pause for a second for we're going to ask you all to do the evaluation, and then we'll share some resources. So I'm going to post the link to this in the chat box for you. And if you could just take a minute or two right now while Brenda shares some resources, we would appreciate it.
Thank you, Margaret. On our resource page on your screen, you will see the CDC's website for Act Early. Our second resource is the Extra Resources on Child Find, and you will also, under that resource section, you will also find the Child Find self-assessment that Exit, Daisy, and OSEP developed together. And that's also on the Grad 350 website for OSEP. And also Birth to 5, Watch Me Thrive, which is the collaborative effort between several agencies for child find and screening and such. So those are 3 very good resources to use as you look at child find efforts within your state. I want to, are there any questions in the chat box, Margaret, or any comments?
I don't see any more questions. If you have questions, please go ahead and enter them. The link to the evaluation is posted. Oops, that's why I posted it to all panelists. Let me fix that. Thank you. Okay, so now in the chat box, you should be able to access the link to the evaluation. Thank you for speaking up.
Do you want to give a couple more minutes for folks to fill out the evaluation?
Sure. Yeah, if you've got a couple, and again, I think we're at the end of our presentation, so if anybody has other questions, we do have a few more minutes to answer some questions for you. We know you all are very busy, so we also understand if you're needing to leave us. So I'm not seeing any additional questions come through, so I think we can go ahead and conclude.
All right, well, thank you, everyone. This is Brenda Wilkins. I want to thank our panelists and Margaret for joining us today. And if you have any questions or comments, you can feel free to, I guess, send them to me. I'm not sure. Margaret, maybe. Did you want to give your email or? Oh,
Sure.
Thank you, Margaret.
I just entered my email address. It's margaret.gillis@sri.com. You're welcome.
I guess you can put mine in there too, brenda.wilkins@ed.gov.
And if you have questions, we can direct you to the presenters if you have questions specifically for them as well.
And thank you, everyone, for joining us. Thank you, Margaret. Have a wonderful holiday weekend, everyone.
And this